Good afternoon, everyone. We have reached our last week of the case-based discussions, which are going to be about the pediatric medicine. And I believe it's a very interesting field. I'm sure you all know who is a pediatrician, which is basically a doctor who deals with children. But my question here is that what are the range of ages are we talking about here? Yani, until which age a person is considered a child? Any ideas? I know it's a kind of a confusing question, but usually a pediatrician deals with people who are 18 years and younger until 1 month of age. And people or cases who are less than 1 month of age are considered infants, and they are dealt with a subspecialty in pediatrics, which is neonatology. So neonatologists would deal with these infants. But for today, regarding my case, I rotated last year in Angelina Children's Hospital, which I found this really interesting case. So imagine this, you are a pediatrician and there is an anxious mother who came or brought to you her child complaining of high-grade fever that has been persistent and not subsiding at all. Uh, Before we start talking about the next steps in management, I want to ask you what usually comes to your mind when we talk about fever, and what are the general causes of fever? Any
Infection.
ideas? Yes, definitely. This is the most common cause of fever. So any inflammatory process in the body can lead can lead to fever, including the most common one, which is infection. But we also have non-infectious causes. Do you guys know some examples? So again, any immune, exactly, yes. Immune-based disorders, hormonal disturbances, and so much more. All of these can lead to fever. So I'm sure you all know the next step in management is going to be history taking. Now, the history in pediatrics is more or less similar to children, to adults. However, there are some differences. We'll talk about them in a minute. You imagine that you did the history, and these are the findings. This is an 8-year-old boy who had fever for 7 days. Actually, I forgot to do this. Yes. This is an 8-year-old boy who had fever for 7 days that has been high grade and continuous. There's some relief with paracetamol. The mother also noticed that there is red eyes. His tongue is red with bumps on it, which resembles a strawberry tongue. We'll look about it in a minute. He has rash all over his body except his face. And like many systemic conditions, he also has or experiences fatigue and decreased appetite. Regarding the associated symptoms, none were there. For the review systems, it was unremarkable. And for the past medical history, he was admitted last year because of acute otitis media and was treated with antibiotics with no complications. And you need to ask about vaccines, make sure that the vaccines are up to date. Regarding past surgical history was unremarkable, medications were unremarkable, he's not taking any chronic medications, and he doesn't have allergies. Now, regarding birth history, this is something new and it's special for pediatrics, you need to ask about it. So it is subdivided into 3 parts, the antenatal history. So before birth, when the child was still a baby in his mother's uterus, you need to make sure that during pregnancy, were there any complications, any problems during pregnancy. In this case, alhamdulillah, nothing was wrong. Regarding the natal history, so during delivery itself, you want to make sure were there any complications during delivery? Was it a C-section or was it a normal vaginal delivery? At which week was the baby delivered? And so on. So for our case, he was born by a normal vaginal delivery at full term, which again, unremarkable, alhamdulillah. Finally, the postnatal history. So after birth, after delivery, what happened to the baby? Was he fine? Did he develop any problems? Was he admitted to the NICU, which is the neonatal ICU? Now, again, in this case, no problems happened, fortunately. Another important thing you need to ask in pediatric history is the developmental history. So you want to ask about these 4 milestones, the gross motor, the fine motor, language, and social skills. And in this case, it was all appropriate for his age, alhamdulillah, indicating that there is no developmental delay. And ask about the nutritional history, make sure if he's following any specific diets. And for this case, recently he has been having a lack of appetite, which is to be expected in such condition. Finally, the family history is unremarkable. No family member had similar condition, and none of them have chronic diseases. And for the social history, he lives with his family. He's an alone child. No one in the family smokes or drinks, and there are no pets at home. So this concludes the history taking. So what is the next step in the management? Any ideas? Yes, this is it.
Vitals and
Definitely,
physical exam.
vitals. Exactly. Vitals and physical examinations. So as we can see here, the vitals are more or less normal for his age. However, the temperature is a bit high, which is 39.6 Celsius, which is actually quite high. Now, another thing, along with the vitals in pediatrics, you need to also measure the growth parameters, like the height and weight, and plot them on the growth chart. For, for example, we can see here this patient's growth chart. His age, according to his age, his weight at the 50th percentile, which is normal, and his height is at the 90th percentile, which is also normal. What does that mean? So anything below these lines or above it may indicate a problem with growth, and we need to ask any questions to know, investigate more about that. But luckily, in this case, he's fine. Okay. And as you mentioned, the next step is going to be physical examination. Like any case, we start with general examination and then we go for this, the specific examinations. And the findings in this case, it was maculopapular rash covering all the body except the face. Both his eyes, we can see that they are red, indicating conjunctivitis. The tongue was cherry red with bumps on it, resembling a strawberry. And his hands and feet were red, swollen. The rest of the examinations were normal. They were unremarkable. So based on what we mentioned so far, what do you think the differential diagnoses are? Any ideas? I know it's a bit of a tough case, and so these are the differential diagnoses. We have conditions like Kawasaki, scarlet fever, viral exanthems, retinal multiforme, infectious mononucleosis. So we have some infectious causes, some non-infectious causes, and I know some of these conditions the younger students haven't heard of them. But today I'm going to focus mainly on the top differential, which is Kawasaki disease. All right. So what is Kawasaki disease? It's a rheumatic condition. It's an acute condition or acute necrotizing inflammation of the blood vessels. Unfortunately, we don't know the exact reason behind it, but we know that it's common in among those who are Asian, with Asian ethnicity. And it's one of those diseases that once there are certain criteria are met, you can diagnose it without the need to do further investigations or tests. So what are those criteria? You must have fever lasting for at least 5 days and have at least 4 out of these clinical signs. So oropharyngeal mucositis, such as strawberry tongue, this is present in this case. Bilateral conjunctivitis, also present in this case. Polymorphous rash and palmar plantar erythema, both are present, except the cervical lymphadenopathy. So we have 4 out of the 5 criteria, and we have fever more than 5 days. So we can diagnose this case as Kawasaki. Now, generally, the patients with Kawasaki disease, they don't look critically ill. However, it is considered a pediatric emergency. Why? Because of its complications. Unfortunately, Kawasaki disease can lead or cause development of coronary artery aneurysms. And these aneurysms can rupture or develop thrombosis, which can lead to myocardial infarction and arrhythmias. Imagine a child developing myocardial infarction. Usually when we think of MI, we think of older adults. But having a child to develop MI, it's a bit rare or strange. Unfortunately, Kawasaki disease is one of the reasons that can make that happen. But that's why it's considered a pediatric emergency, and it has to be treated immediately. So here are some of the investigations ordered. Now, even though I mentioned earlier, we don't have to do investigations to diagnose Kawasaki since it's a clinical diagnosis, but why do you think we did these investigations? Any ideas? I know the condition is clinically diagnosed, but sometimes we need to do investigations to rule out other causes. So we can see here that white blood cells, CRP and ESR are all high, indicating that there is an inflammatory process. The urinalysis, throat swab, blood culture, and urine cultures are all normal, indicating or at least ruling out some infectious causes. And here in the electrolyte, the sodium and urea are a bit low, which is to be expected in a child who's with decreased appetite, who's not eating or drinking well. So there is some kind of dehydration here. And finally, an echocardiogram was also ordered. You guys know why, in this case especially.
To get the
Remember?
baseline of what his heart looks like.
Exactly, to get the baseline and also check if the complications has developed or not. Okay, like the coronary artery aneurysms that I mentioned earlier. Okay, thank you. So what about the
I
treatment
have a
plan?
question.
Yes, please.
Can you go back to the previous slide?
This one? This slide?
Okay. Yeah, the slide. It was a bit laggy on my end. Why are sodium and urea here low? Especially since I think in the history you said he did not have any nausea or vomiting.
I'm sorry, could you repeat that?
Why is the sodium and urea low?
Yeah, because as I said, he's not eating properly, not drinking properly. There could be some kind of dehydration that's happening. Does that answer your question?
Yes, thank you.
Okay. So yeah, back to the treatment plan. This is one of the ways to formulate treatment that one of the consultants taught me, and I think it's really efficient. So basically, we'll divide our treatment. By the way, this can go for any disease, not just any pediatric cases. So we divide the treatment into 3 categories. First, supportive treatment. You want to treat the symptoms. So for my case, the patient had fever, so I start him on antibiotics like paracetamol. He had, based on the labs, he had dehydration of, I'm going to start him on IV fluids. The second category is a specific treatment to the disease. So how do we treat Kawasaki? We start them on IVIG, intravenous immunoglobulins, in addition to high-dose aspirin. And then the final category is treatment of complications if they already have that, or the prevention of complications. So in this case, we're going to switch, once the symptoms resolve, we're going to switch the high-dose aspirin to low-dose aspirin to prevent or at least reduce the risk of complications. Why are we using aspirin in high dose and low dose differently? Why can't we stick with one dose? Does anyone know?
In low dose, it's for the antipyretic effect, so like to decrease the fever. And then high dose aspirin is for the actual management. So
Yes, exactly. Good thinking. So the high dose aspirin, even though it's the same drug, but on different doses, it will have different actions. So in high dose aspirin, it primarily has an anti-inflammatory effect, which is what we need in the acute phase. And we switch to low dose aspirin because it will have an antiplatelet effect, which is to prevent or reduce the risk of complications. And finally, the follow-up will be in the cardiology clinic at 2 and 6 weeks post-treatment. And during these follow-ups, we need to repeat the echocardiogram. So again, why is that? To make sure the complications hasn't developed. So these are the learning points. They are basically a summary of what we have discussed so far. Now, finally, I would like to share a real-life experience or what happened to this case. Now, it is recommended to start the treatment of Kawasaki within 10 days from diagnosis, because once you reach the threshold 10 days or after the 10 days, the treatment is going to be less effective and risks of complications are going to be high. So it's recommended to start within these 10 days. Regarding this case, it was his day 9, and he has been seen by 2 teams, the pediatric team, who believe that this is a Kawasaki disease. And since it's day 9, you need to start the treatment as soon as possible before you reach the threshold. And the second team, which is the rheumatology team, they actually don't believe that this is Kawasaki because the rash is a bit atypical. And they think yani, we should wait for further investigations and make sure yani, wait for further investigations and not to put the patient on the risk of developing side effects of the treatment. And by the way, yani, this is quite common. You're gonna see it, or if you haven't already seen it in the clinical field, well, where it's not always black and white, you always have this gray zone cases where you're not sure about the diagnosis. That's definitely with the clinical experience, your clinical judgment will improve. But either way, what do you think? Should the patient start the treatment or should we wait? There's no right or wrong here, yani, but I'm interested to know your opinion.
I think
Any
start
thoughts?
treatment. Just in
Okay.
case, because the complications are way more serious of like Kawasaki than the
Yeah.
complications for having aspirin.
Yes. True. Any other thoughts?
I would also
So
I
say
agree
start
with
the
starting
treatment.
treatment as well.
yes. Okay.
Yeah,
Great.
for my point, I would say also to comfort the mother, honestly, so that you can like show that you helped or did something.
Yes. Definitely. Okay. So they did a meeting, both teams, and I was lucky enough to be part of the pediatric team in that meeting. And they discussed the case thoroughly, and they yani, concluded that, as you guys mentioned, the benefits outweigh the risks here, and they started the treatment. And alhamdulillah, the patient has improved rapidly. And during the follow-up, yani, sorry. Okay. They started the treatment, and alhamdulillah, the patient's symptoms has improved rapidly. And on the follow-up, the complications, none of the complications has developed, and his echo was normal. And by the way, this yani, improvement of symptoms and no complications developing, this further confirms the diagnosis of Kawasaki. تمام? And yes, I believe that's the end of my presentation. Thank you very much and wish you all the best.